The UK was the first country in the world to administer a vaccine. We delivered the fastest rollout in Europe, and we've begun the fastest booster campaign too, with over 500,000 jabs delivered yesterday alone. And these achievements, made possible by the extraordinary efforts of our NHS, including thousands of GPs and volunteer vaccinators, have literally saved countless lives and livelihoods in this country. But I need to speak to you this evening because I'm afraid we're now facing an emergency in our battle with the new variant, Omicron. And we must urgently reinforce our wall of vaccine protection to keep our friends and loved ones safe. Earlier today, the UK's 4 chief medical officers raised the COVID alert level to 4, its second highest level, because of the evidence that Omicron is doubling here in the UK every 2 to 3 days. And we know from bitter experience how these exponential curves develop. No one should be in any doubt. There is a tidal wave of Omicron coming. And I'm afraid it is now clear that 2 doses of vaccine are simply not enough to give the level of protection we all need. But the good news is that our scientists are confident that with a 3rd dose, a booster dose, we can all bring our level of protection back up. I know there will be some people watching who will be asking whether Omicron is less severe than previous variants and whether we really need to go out and get that booster. And the answer is yes, we do. Do not make the mistake of thinking Omicron can't hurt you, can't make you and your loved ones seriously ill. We've already seen hospitalizations doubling in a week in South Africa, and we have patients with Omicron in hospital here in the UK right now. At this point, our scientists cannot say that Omicron is less severe. And even if that proved to be true, we already know it is so much more transmissible that a wave of Omicron through a population that was not boosted would risk a level of hospitalisation that could overwhelm our NHS and lead, sadly, to very many deaths. So, we must act now. Today, we're launching the Omicron Emergency Booster national mission, unlike anything we've done before in the vaccination programme, to get boosted now. A fortnight ago, I said we would offer every eligible adult a booster by the end of January. Today, in light of this Omicron emergency, I'm bringing that target forward by a whole month. Everyone eligible aged 18 and over in England will have the chance to get their booster before the new year. And we've spoken today to the devolved administrations to confirm the UK government will provide additional support to accelerate vaccinations in Scotland, Wales and Northern Ireland. To hit the pace we need, we'll need to match the NHS's best vaccination day so far and then beat that day after day. This will require an extraordinary effort. And as we focus on boosters and make this new target achievable, it will mean some other appointments will need to be postponed until the new year. But if we don't do this now, the wave of Omicron could be so big that cancellations and disruptions, like the loss of cancer appointments, would be even greater next year. And I know the pressures on everyone in our NHS, from our GPs, doctors, nurses to our porters, all of whom have worked incredibly hard. And I thank them for all the amazing work that they've done. But I say directly to those of you on the front line, I must ask you to make another extraordinary effort now, so we can protect you and your colleagues, and above all, protect your patients from even greater pressures next year. So from tomorrow in England, we're opening up the booster to every adult over 18 who has had a second dose of the vaccine at least 3 months ago. The NHS booking system will be open for these younger age groups from Wednesday, and that's the best way to guarantee your slot. But in some places, you can walk in from tomorrow. We will also assist this emergency operation by deploying 42 military planning teams across every health region, standing up additional vaccine sites and mobile units, extending opening hours so clinics are open 7 days a week with more appointments early in the morning, in the evening and at weekends, and training thousands more volunteer vaccinators. And we'll set out further steps in the days ahead. It's because of the threat from Omicron that I announced on Wednesday that we will move to Plan B in England. You must wear a face covering in indoor public spaces, and from tomorrow, work from home if you can. And from Wednesday, subject to a vote in Parliament, you'll need to show a negative lateral flow test to get into nightclubs and some large events if you're not double vaccinated. These measures will help slow the spread of Omicron, but we must go further and get boosted now. If you haven't yet had a vaccine at all, then please get yourself at least some protection with a jab as quickly as possible. If you've already had your booster, encourage your friends and family to do the same. We're a great country. We have the vaccines to protect our people. So let's do it. Let's get boosted now. Get boosted now for yourself, for your friends and your family. Get boosted now to protect jobs and livelihoods across this country. Get boosted now to protect our NHS, our freedoms and our way of life. Get boosted now. Thank you very much.
So that was the Prime Minister with the simple message, get boosted now. He said we are facing an emergency in our battle with the new variant Omicron. He said we must urgently reinforce our wall of vaccine protection to keep our friends and loved ones safe. He went on to say that there is this tidal wave coming and 2 doses of a vaccine simply aren't enough. Don't make the mistake of thinking Omicron can't hurt you, he said. And then the breaking news this hour that in England, every adult over the age of 18 who had a second jab at least 3 months ago is eligible for a booster and can book one from Wednesday, or even in some cases go to a walk-in centre from tomorrow. So that statement coming from the Prime Minister. Let's speak to our political correspondent, Kate McCann. She's in Westminster for us. Kate, Nicola Sturgeon a few days ago said that a tsunami was on the way when it came to Omicron. The Prime Minister saying a tidal wave, but the message couldn't be clearer, could it?
No, and I think couple that with the fact that earlier on this evening, the COVID emergency level moved from 3 to 4, and you get a really clear indication of the sense of concern among health professionals, amongst politicians, about what Omicron is going to mean for all of us over this winter period. Now, again, important to say that we just don't have the full data yet, but I think the early indications about what this new variant means are not particularly promising. I think that's why the government has decided to move quickly. We've also heard today confirmation for the first time that there are now people in hospital with Omicron, whether or not they have been admitted because of the virus or that they are in hospital anyway and that they have the virus. That remains unclear, but I think the point is that it is now circulating fairly widely in the population, and it could easily cause problems for the NHS if the case rates are high. If it's very transmissible, if lots of people catch it, that means lots of people will get infected, and for some of those it will be serious. And that's why the Prime Minister, as you say, is making this very ambitious promise to bring forward that deadline which he had set for the end of January to the end of December for everybody over the age of 18 in England to get vaccinated. Now, you know, that offer will be there for people if they want to take it up. There is the hope that they will. But we also heard, of course, today that around 4.8 million people have had no vaccinations at all. And that remains a significant problem for the government, that hesitancy, that reluctance to come forward and get any kind of protection, something that the Prime Minister did mention. And some of the language in that statement too was, I think, particularly stark, if you like, at the end there, essentially warning that this is the way to protect our way of life. It's not new restrictions, but it is a threat that actually this is the first post in trying to make sure that Omicron doesn't overwhelm the NHS, doesn't make it really difficult over this winter period. People now need to go and take up that offer. Now, we know that the NHS is going to struggle to give that to make that offer happen, which is why the military will be involved. It's why we expect there will be new walk-in centres, there'll be longer hours, earlier and later opening for people who work. But it will be all about reaching those hard-to-reach groups, going out into the communities, ensuring that everybody understands this offer and takes it up quickly. That will be where this protection really comes into its own. And without it, I think the NHS will struggle, but the Prime Minister will struggle too, because if people don't get boosted, if people refuse to, if they think it's not important or it's not relevant to them, or, you know, it's only pretty mild, it's probably not going to affect me. Remember, this is not just about all of us, it's altruistic. That's what vaccination is about at the end of the day. It's about protecting everybody in society. I think if that message doesn't penetrate, then things could get quite difficult, and that's the point where you really start to see that conversation about further restrictions.
As you're speaking, Kate, we've had a response from Sir Keir Starmer, leader of the Labour Party, to the Prime Minister's statement. He says it is more important than ever to get Britain boosted to protect our NHS and save lives. The arrival of the new worrying variant is a reminder that the pandemic is not over and vaccines are the best weapon in our fight. He went on to say the vaccine is safe and effective. It protects us and those around us. We'll always support the NHS and act in the public interest. He goes on to say we've come so far since those darkest of days at the start of the pandemic, and then repeats that message telling people to get boosted. You mentioned the language that the Prime Minister chose to use, and something struck me right at the end of his statement. He said, get boosted now to protect our NHS, protect our freedoms and our way of life. Do you think there was a message there potentially to those Tory rebels who are so concerned about our freedoms being restricted?
I think there probably is. I think there's also a broader message to that group that I just mentioned there who are unvaccinated. The Prime Minister was pretty stark when he was talking about people who are unvaccinated earlier on this month, suggesting that there could be a conversation about how to ensure those people are vaccinated. But you're right to pick up on the politics of this, of course, because the measures that the Prime Minister has introduced will need to be voted on this week. There are a rump of Conservative MPs who do not like them, they will not vote for them, and that's a growing group. And their concern is freedom. They feel the Conservative Party is about personal choice, it's about liberty, it's about freedom to choose how you behave. And they don't like this encroachment, this constant reaching for restrictions. That's how they characterise it. Of course, the Prime Minister is balancing all of that political turmoil with the turmoil that's going on in the NHS and the potential for that being overwhelmed too. Those are two very, very difficult things to make, well, to meet in the middle, if you like. They're really difficult to reconcile. And so it's an unenviable task for the Prime Minister. He will get that vote through because he will have the support of Sir Keir Starmer, the Labour leader. You heard in that statement there, wholesome support for this booster campaign. They have consistently pushed for the Prime Minister to do more and do it more quickly. But that question remains about the politics of this. It's rumbling beneath the surface, and no doubt in the Prime Minister's mind tonight, sitting there giving that address, something that is unprecedented, fairly unprecedented. We saw these previously when we talked about lockdowns. It's not a normal thing to do. For the Prime Minister to sit there tonight, give that address, I think this was as much about appealing to those to get a booster as appealing to his party to say, look, get behind me, because without them, he's really going to struggle to deliver this, I think.
OK, Kate, in Westminster, thank you very much for that analysis. More reaction to the Prime Minister's comments coming in. The First Minister, Mark Drakeford, First Minister of Wales, of course, has also issued a statement. Let me bring that to you. He says, we are learning more about the Omicron